So a plan, but our patient should have needs above and beyond that. Okay. Well, I'm going to give you a heads up. Dr. Hetrick, so this is not you telling, it's giving them a heads up, correct? Dr. Hetrick may recommend that she invites you back at no charge to you to come back to allow her to look at the plan and formulate a more personalized plan for you and have you come back within a week to present it to you.
Oh man, that sounds like a lot.
It is. So again, I totally get it. The benefit of this is it allows us to plan your care out so that we can get your care done in as few visits as possible. The other alternative is we can chop it up and do it over multiple visits, which works better for you.
And then they pick?
Then they pick.
Yeah. I just need to look at this broken tooth.
Okay, no problem. So that's a person that had complex care needs, but self-selected to minor treatment. Right side versus left side. Okay? Has this many complications, but self-selected, or we select them back to this. Okay? Well, I'm going to give you a heads up. Dr. Hetrick, so this is not you telling, it's giving them a heads up, correct? Dr. Hetrick may recommend that she invites you back at no charge to you to come back to allow her to look at the plan and formulate a more personalized plan for you. So the first thing I'm going to have you do is always click zone.
Zone.
And then click that button there.
The yellow.
Yep.
Can I write down?
Absolutely.
Okay.
And I want you to always work from zone and the yellow.
Okay.
This makes for you and have you come back within a week to present it to you.
Oh man, that sounds like a lot.
It is. So again, I totally get it. The benefit of this is it allows us to plan your care out so that we can get your care done in as few visits as possible. The other alternative is we can chop it up and do it over multiple visits, which works better for you.
And then they pick?
Then they pick.
Yeah. I just need to look at this broken tooth.
Okay, no problem. So that's a person that had complex care needs. Good morning. As you can see, we started a day early. One of the things that we promote is a monthly team training every month for 2 to 3 hours. Last year we were doing these on Wednesday afternoons. It was getting in the way of our schedule. So this year we but self-selected to minor treatment. Right side versus left side. Okay? Has this many complications, but self-selected, or we select them back to this. We move them to Tuesdays from 7 to 10, so that allows me to be more present and not eat into my production time personally, selfishly. So that's what you kind of saw this morning. We review the numbers, we go through some training. Today we didn't do any role playing in terms of phone calls and treatment planning. We did kind of a year-end review and the year moving forward, things that are important. And then I did some one-on-one training on some software that's changing the practice. Now I'm going to go sit with our admin team for 30 to 40 minutes and kind of do some planning there as well. So that gap he's feeling right there is right there. That'll be fixed. Grind around. Open. Like that it's riding right there and right there. So I'm going to just adjust those a little bit.
Discoloration and
Leave that in there, okay?
I'm just holding this piece out of the way.
And just stay biting just like that. Go ahead and switch. Okay. With the leaf gauge, the reason we use bite registration, so there's no compression of the jaw, so that way he has something on the back to kind of has a stopping point, okay? Now the key here is I want to stay relaxed. Okay. Cosmetically, I'm not going to lengthen these teeth too much here in the front.
Okay.
So what I'm going to do is might be a little bit too much.
Make me look pretty now.
I am. I'm just.
Oh, look at that bad boy. I'm shooting him up.
Yeah, you
I
should
got
have.
vampire teeth.
You do. No, you have sharp teeth. You've beaten the.
You already
crap
see.
out of it. You want to take his bite again. Basically, at this point, the next step is about a month from now. We'll go ahead and schedule him to put his trial smile in. I told him we're not perking his teeth. He doesn't need to be sedated for that.
Hour?
An hour and a half. So
Upper, lower?
Upper lower. Yeah, hour and a half. So I have plenty of time.
Okay.
And then that's it. Patient here that we did an overdenture on many years ago. We lost this implant. Now we just have one left here. So we're going to take our locator off, put a cover screw on, so that way we can not have everything hanging onto one implant. For me. Good news, implant. Ask Doc Jock. I am referring you a patient, but this referral sheet you have given me doesn't have a phone number anywhere on it. So luckily my patient knows how to use the internet, and they'll go to your website and find your number and contact you. So we moved to the Chefla chair, the Anthos. One of the things I love about the chair, very similar to the former chair we had, is that we have this motor right here, does restorative. When we have the restorative handpiece on there, I can do endo with it, so it has a built-in apex locator and endo motor. And then I can move it to the implant mode, which is what I'm doing now. And now I can do my uncovery in this case. We're going to be doing an uncovery. Typically I don't do a tissue punch, but we've got so much keratinized tissue right here that a tissue punch is very appropriate in this case. If I were placing the implant, I definitely would not do a tissue punch. We're going to use our bone profiler here, just in case there's any tissue or bone that's overgrown the implant. There we go. Seats nicely. Floss. Check with floss. Nice contact on the distal, nice contact on the mesial peroxide. Clean out our screw access. Can you clean the tip of the pusher? Put our Teflon in. And now we're going to now it's time for some composite. Great. Mr. Penny, bite down for me. Chew on that like some gum. Open. Okay, just a little.